Okay, wonderful. All right. Okay. If you don't mind, if you're able to, Jassy, put the agenda in the chat. Good evening, everyone. Hopefully you all on Zoom can hear us. I believe Captain Muir said we were coming through loud and clear. Good evening. I'm City Councilman Woody Lightfoot. Welcome to the August Rock Against Gun Violence Coalition monthly meeting. Before we get started this evening, it has been brought to my attention, ladies and gentlemen, that we have a shooting that's actually just happened within the last hour on Denver Street and Melville Street. We have 3 victims that have been shot. One seems to be very critical, and that's happening. And I know I can see one as young as 17 years old. That's happening as we speak. That incident is happening right now. So what I would like to do is start off with a moment of silence, as we typically do for these meetings, and just keep not only our first responders who are responding to these incidents and or hospital personnel who are dealing with this incident as we speak, and or boots on the ground, whether it's our crisis intervention and or whomever may be working this along with the victims and families that are impacted in the community, that are being impacted. Look, what is it, 6 o'clock on a Monday evening, you know? And so I just wanted to start with a moment of silence. Thank you. Thank you, amen. We're praying, of course, for the safety and for all of this to hopefully everything to come and work out well as best as possibly can in this particular situation. But I think it speaks to the work that we do daily, some of us, and or of course our RPD and those who are on the ground on a daily basis, as well as the work that we do collectively in our individual spaces in regards to gun violence. I believe that, you know, when these types of things happening, they give us even more reason to continue this work and how important this work. I say I don't really like to highlight, some would even say boast or brag, if you will, about crime going down. That's not attractive to me. Until we have zero violence in our community, zero shootings in our community, that's when I will begin to get excited. Of course, we want crime to go down, and that's progress. But we're looking for zero shootings and crimes in our community. We'll keep working passionately until we see it in that direction. You should find, ladies and gentlemen, and we have a lot to cover tonight. In the chat, you will see the agenda. I'm going to ask for our folks that are in person, those who maybe your first meeting, or you, would you just introduce yourselves, please? Speak up so that they can hear you. And then I'm going to ask for those on Zoom, if this is your first meeting, your first Rock Against Gun Violence Coalition meeting, I'm going to ask you to identify yourselves and your organization that you're with. Thank you. We'll start in person.
Good evening. My name is Dr. Maria Elena Velez Brown. I'm the acting commissioner for the Monroe County Department of Public Health. We are pleased to be here tonight with a number of members from my team to discuss how we can partner. And we have brought some consultants with us from the Cure Violence Global team that many folks are familiar with. So we're happy to be here and see how we can collaborate and add to this effort that's so sorely needed. Pass it off to my colleague.
Hi, I'm Dr. Shally Sadie, also working on Cure Violence at the Health Department.
We have our intern with us, Julia.
Yes. Hi, everyone. My name is Julia Smith, and I'm also with the Department of Public Health.
Thank you.
Great. Well, welcome, the Department of Public Health. So glad to have you guys with us. And we appreciate you reaching out to us. We appreciate the work that you're doing, and we appreciate the work that we're going to do collectively together in the very near future. So I want to thank you for that. Those who are on Zoom and maybe your first time attending a Rock Against Gun Violence Coalition meeting, please, sir, please, ma'am, if you would unmute yourselves and just identify or introduce yourself and who you're with, please. Okay.
Good
Good afternoon, everybody. My name is Ennis Jeff. I am the director of the GIS Scholars. I am here today with Joseph Becker.
Welcome, sir. Welcome.
Thank you. I'm glad to be here.
Glad to have you. Mr. Becker, you're with GSI Scholars as well, correct? Mr. Becker, can you hear us?
Yes, I've been the advisor since they were formed back in 2012, not far from where that shooting occurred an hour ago.
Wow. Okay. Very good. Well, welcome, both of you guys. Welcome. Is there anyone else on Zoom that may be your first time?
Yeah, hi, this is Brent Decker, Chief Program Officer, Cure Violence Global. Thank you for having us this afternoon.
Welcome, sir. Welcome. Cure Violence, are you going to be presenting with us today? Okay. Yeah. So
That's the plan.
I'll make sure when we get to that point that you have screen sharing capabilities. Thank you. Yeah. All right. Let's see here. Anyone else?
Hi, can everyone hear me?
Yes.
Hi, my name is Hannah. I'm with Monroe County's newly developed team research strategy and development. I'm filling in for my supervisor, Dr. McGinnis, but I'm looking forward to continuing to come and seeing what's happening in the community and how else I can support.
Welcome. Thank you for being with us. Appreciate your attendance, and we have a lot of our county folks that are kind of connecting with us, and we're really excited about that connection with the county because, you know, we have our ATF folks on board, you know, of course, of our city, and then with our county, it's very exciting to have all of you guys with us. So we appreciate you. Thank you for being with us. Anyone else on Zoom, maybe your first time?
Yes, good afternoon. Good evening. My name is Keonis Cornel here with Cure Violence Global, Regional Associate Director. Glad to be here with you all this evening.
Welcome, Keonis, you said? Q.
Keonis, yes, sir. Everyone calls me Q.
I like that. Thank you. Welcome, Q, man. Appreciate you being here with us, sir. All right. Anyone else? Okay. All right. We're going to go right along with our agenda. Typically, this is we share a lot of information at these meetings. Our meetings are hybrid. So they're the second Monday of each month here at City Council Chambers on the 3rd floor from 6 o'clock. We typically go about an hour and 15 minutes at the most. We also are streaming on the City Council YouTube page live. And then, of course, there's Zoom for our partners, or if someone calls in and they ask for the Zoom link, we'll send that out to them. So we try to make these meetings as transparent and as easily being able to convenient as possible, because we don't want anyone to have any excuses. It's one of the good things that came out of the pandemic, I think, really, is it taught a lot of us how to use Zoom and our virtual meetings. So we've continued that outside of Zoom too, and we've had pretty good participation as a result of that. And we appreciate all of our partners on this. So we're going to go right into our reports. We also have several committees that we have with the Rock Against Gun Violence Coalition. And we're always looking for people who may want to join a committee. Feel free to reach out to myself or Dassy. All of our partners, hopefully you receive, Dassy is very, very good at communication. So we make sure that you receive the agendas, you should receive our minutes, you should receive all of the information in regards to the work that we're doing. And we really try to keep you as informed as we possibly can of what we're doing on our website, which is City of Rochester /Think About It. Or if you just Google Rock Against Gun Violence Coalition, it will take you to the City of Rochester website. All of our information as far as our committees, the description of the committees, what they do, who are the chair people of the committees, is all on our website. So feel free to dive in and do your research about that. If you may have interest in sitting on one of our committees, we really we really want to recruit, and hope that you would consider, working and volunteering, for maybe one of our committees, all right? So, at this time, based on your agenda, we'll go into our RPD update, and I'll turn it over to Captain Mura.
Good evening, everybody. I'm going to get through this as quickly as I can. And when I'm finished, I will send out an email to the group or to Dazzy, and she can send it out as needed, containing all the information that I'm going to go through, plus a little bit more. So this data was compiled up until the end of July, so it's only accurate plus or minus a couple of statistics up until the end of July. So at the end of July, we had 492 shots fired in the city that were recorded or registered. We had 96 shootings with a total of 125 victims. Homicides, we were at 28 as of August 1st. Last year, our homicide total was 58. For July, we had 40 handguns that we took off the street, 4 long guns. 12 of those guns total were ghost guns. So we actually had a total of 56 guns taken off the street last month, 12 of which were ghost guns. Due to those guns being taken off the streets, we had 76 criminal possession of weapon arraignments in Monroe County during the month of July. So CPW second charges for 76 individuals last month. Of those, 16 individuals were held without bail. 49 individuals had cash or bond bail set. 8 individuals had the cash bail set at $5,000 or less. 6 of the individuals were released with non-monetary conditions, and 5 are unknown. I just couldn't get the data on the remaining 5. So out of the 76 indictments, one of the questions that was asked to me previously was if we could figure out where the individuals were from out of state and the towns and the city. So out of the 76, 2 of the individuals were out of state, 2 were from Brighton, 2 were from Irondequoit, 5 were from Greece, 1 Gates, and 64 were from Rochester. The spreadsheet that I'm going to send in the email also shows whether the individuals were black or white, their age, and which individuals were out of state or out of the city. So that's the data I have. I know that Kathy had sent me an email asking for a litany of information regarding a few different things, and I'm unable to hand that information off at this point because, quite frankly, I don't have it, and some of the information that was requested could influence ongoing investigation. So I'm going to leave that to the ATF to answer that portion of it. Mm-hmm. However, that's all the information I have at this point. And after today's meeting, again, as always, anybody here can email me any questions or concerns you have, and I'd be happy to give you a call back and discuss it with you.
Thank you, Captain Mura. There was a question in the chat that was asking, were there any gang affiliations, and if so, which?
I'm not at liberty to say right now. I'm certain that some of them probably were, but I don't have the data in front of me, and I wouldn't want to be quoted or misquoted by not having the information directly in front of me. But I would say that there's a pretty good probability that some of them were gang related, but I couldn't tell you without looking at each case individually.
Quick question, Captain Mura. This is Kathy. And by the way, thank you. Thank you for trying to get that information. You mentioned that there were 76 criminal possession arraignments made. I was wondering, of the 76, how many in those cases were the guns illegally possessed? I guess in all of them, correct?
That's my understanding, yes. Okay, and Captain Mura, you may not be able to answer this one, but
Do we know, concerning the Brady report? Concerning that Brady report that we did for the city of Rochester, I'm just wondering, are you aware? You don't have to tell me or the audience, but are you at least being informed as to whether the supply sources that were identified in our gun trace report for you, for the ATF, are any of those supply sources ongoing supply sources in the current criminal possession of weapons that you're addressing right now? In other words, are the
No,
guns?
I understand the question. I wouldn't have that information. That would the ATF would be better served to answer that if they had the information. I certainly wouldn't have it.
Right, but I'm hoping that someone is taking the data that we gave to you, not you, Captain Mura, but to law enforcement in general, and is tracing back not only as a individual supply source in a specific case, but whether or not there is a recidivism occurring here, where there are repeat offenders of supply sources involved in why there is so much illegal gun possession in the city of Rochester. I'm wondering, is that even being looked at? Is it to alleviate some of what you're addressing and local police are addressing with this incredible flooding of illegal guns into the city? Is anybody looking at it?
So I can tell you that yes, they are. However, the Rochester Police Department focuses directly on Rochester, so that would be an outside of the city of Rochester investigation. So again, you're going to have to ask the ATF and the state police. I'm certain that they are, and anytime we can make an arrest when somebody is doing something illegal or allowing it to take place, it happens. I just don't know how much they're able to share with you.
I understand, Captain Mura. Thank you so much. Thank you.
All right, we're gonna take one more question in-house by Reverend Cox before we move on. We have a lot to cover tonight. I'm gonna ask any questions that you may have that's online or in person that we don't capture for Captain Mura. Please either put them in the chat, write them down, give them, if you're in person, you can write them down, give them the DASI, and we'll capture them. We'll get them in writing via email. Captain Mura is very good at getting back to us with the information. And then when we send out our minutes and our updates to the group, everybody will get that, okay? So I'm gonna take this question. It's a very good question you asked, Kathy, and we're gonna follow up on that because the eradication committee and myself, as well as I'm sure President Melendez, we are working on some legislation concerning the gun trace data report, but we want to make sure that we're getting the bang for our buck out of the current existing, and this is the first month where ATF is not here. They're typically here, or their representative is here. So, oh, they're here? Okay, all right, great. Agent Curran, are you there, sir? I'm sorry if I'm not.
Hey, good evening. No, Mr.
Sure.
Kern's he's still out. He'll be out for a
Okay.
couple months now, but
All right.
yes.
Well, at least you're there to capture some of the questions, and you at least fill him in and update him when he comes back, so he'll know kind of the direction and some of the things that we're looking to be updated on. So I'm going to get this question from Reverend Cox.
Yeah, I wanted to ask Kevin, how many of those arrests are repeated offenders? Does he have that number?
I asked that question, and I believe it's very difficult to get that data. You literally have to take each arrest and do what's known as a file 15, which is an extensive research on the individual. I can get it, but it would take an extreme amount of time and effort for our records department to do it. I don't have a definitive answer, but I will do my best to get it for you.
Thank you, Kevin. Appreciate it.
Absolutely.
I want to thank 2A Concealed Carrier for the information they're providing for us online concerning Buffalo and the identified street gangs and members and the figures and information and data that they got coming out of the FBI office and task force, et cetera. We see that information, and we see Sabrina Lamar, we see that some of the information that you're capturing with Project Exile that's being shared. So we're gonna make sure that we follow up and we make connections with the information that's been asked and make sure we get back to the group in regards to a follow-up on that, because that's the whole purpose of us doing the gun trace data report. We have to be intentional about what's going on within the trafficking of guns in our city. So we'll definitely follow up on that. All right, I'm gonna move on because like I said, we have a lot to cover today. If you have any other questions, please put them in the chat. We'll move on. Is Victor Saunders, are you with us, sir? Or anyone from Vic's office? No, okay. We'll move on to Miss Aaliyah. You can go ahead, please.
All right, good evening, everyone.
Good evening.
Reporting out on the Crisis Intervention Services Unit. First, we'll have Leslie do a report on the data for the Person in Crisis PIC team for July. Leslie? Okay, I'll move forward with my report until she's able to jump on. So the data for our community support team for the month of July, based on zip code areas, we provided outreach and victim services to the 14605 area for 10 people, 14608 for 19 people, for 14611, 16 people, for 14613, 9 people, and for 14621, 29 people.
Yes. Miss Aaliyah, I'm gonna jump in here because I think it's a good space for it. Not only are you the crisis intervention coordinator, but you also are chairing the with Leslie and co-chairing the resource committee too, correct?
Correct.
I know you guys are working on a resource packet or pamphlet.
Yeah.
One of the things I'm asking to be considered, Ms. Aaliyah, is if we're able to, and I think you may have this information, and I'll explain what I'm trying to say. So like when we just had the mass shooting, we just had some of these other events that have happened, the young man that unfortunately passed away in that house fire, right? That was also considered a homicide. Oftentimes my office is receiving a lot of calls from people, whether they're partners or whether they're community, and people want to help, like they want to do something. They want, and so I'm asking, and I saw that there were some visuals, and I just wasn't aware of a lot of the activities that may be happening in regards to when we have mass major incidences within our community. And I would just ask if there's some kind of way that maybe the resource committee, we can look collectively at ways that in our partners, so many of who were involved in some of these visuals and or activities, sometimes there's GoFundMe things, sometimes there's different things that are opportunities to assist families. If we can figure out a way where we can share that information with the coalition, and then the coalition can collectively send out, everybody may not be able to go, but a lot of people will, want to be a part of the visuals, be a part of the GoFundMes, be a part of assisting the families or in any type of way. But oftentimes, the only way there is to find out, and I'm not on Facebook, so I'm the last to get a lot of information because I'm not on Facebook. So, and I know a lot of that stuff shared on Facebook, but so I miss a lot. So if it's not, somebody don't send it to me, I don't have it. And I guess I'm just asking if there's a way that we can put together kind of like, and I'm not looking for like every shooting or every homicide or anything, but when we have like major incidences where, they're highly publicized in the news and, people are doing visuals and all these types of things, balloon releases and all these, it'd be nice for the whole coalition to be on the same page and we can all collectively come to the aid of or support in some form. And that form may look different. I may not be able to attend every event, but then we have a coalition of over 100-something people. Other people may want to attend, or may their churches are in prayer, or, you know, they want to send money or whatever, you know, and assist in any kind of way. I think the first thing I did when all of this happened is I picked up the phone and I text you and I said, hey, you know, what do you need? How can we help? You know, what, you know, direct me in the best way that we can be helpful to you. And, you know, as a city councilman, and then you being a city department, you know, my first incident is how do we support the work that you're doing? And you said, you know, you were good, and I appreciated that. But I'm just looking for ways that we can engage I want to keep our partners, because I get a lot of calls and people be wanting to, and they'll say, well, I didn't know about this, or why didn't y'all send us information? I can't send them information that I don't have. You know, I can't give them notice about things that I don't know about, you know, or I don't have information on. So I would just consider that if you can help us get a little more organized in that area, that would be extremely helpful.
Okay, Leslie and Wanda and myself will take that back to the full committee and try to figure out a way to make that happen.
Thank you. And it's just a matter of just sending the information to Dassy. She's the direct, you know, contact between us, and just to fly off an email to her and then she'll get it out to the rest of the group, you know, as well as I often want to keep, offer this for consideration to our partners too. We got over 30 people on this call. All of our partners, I continually encourage you, if you're having gun violence events or programs or things that are happening around this space, and we want to support that too. If you get that information to us, we're trying to create somewhat of a calendar, if you will, so that we can support each other in the spaces. I think I say this every month. I think I say it every month. But we don't tend to get a lot of the event information until it's over with or until it's happening. And then oftentimes I hear, well, why weren't they here? Or why didn't they show up? Why didn't they help? Or why didn't they? Well, we weren't included, or we weren't given the information. And so that makes it very challenging to try to engage the rest of our partners or everyone if we don't have the information. So I'm just asking, you know, that information be shared collectively. So at least, again, it doesn't always have to be me, but we have multiple partners and multiple people that want to engage and want to help and support.
Okay. The next part of our data report is for the homicide response team. And so we did support all of the homicide victims from the month of July, and they were all connected to services and financial resources by our community support team. So they were all able to receive some assistance from the state. Leslie, can you report out on the person in crisis team?
Apologize, had some technical difficulty, but for the person in crisis team, we have altogether 802 for the month of July, and PIC alone was 94. That was our total numbers for the month of July.
Okay, thank you.
Welcome.
All right, does anyone have any questions for Ms. Aaliyah or Ms. Leslie? All right, well, thank you, Ms. Aaliyah and Ms. Leslie, for the work that you're doing. Thank you so much. I appreciate it. I know you've had a crazy month, and we really appreciate the work that you guys are doing. Thank you. Okay, the Cure Violence presentation. We have a Cure Violence presentation that we have now. Mr. Q, I've made you co-host. You should be able to share your screen at this time. I'm sorry.
Thank you, sir. I'll begin sharing here momentarily.
And put something in the chat. Oh, yeah. Go ahead. I'm sorry. There you go.
Thank you.
You're welcome.
Great. Thank you for having us. I don't know, Dr. Amati, there's something you wanted to say before we give a brief presentation?
No, I'm just glad to be participating, and I was going to yield the floor to you. Go for it.
Okay, great. Q, you can go to the next slide and then to the next one. You can go to the next slide. Yeah, so thank you all for having us. We have just a brief presentation to kind of go over. But I want to say in the onset, we really want to thank the Monroe County Health Department for inviting us to work with them as they're thinking about how can the health department really be a part of the solution to preventing violence in Rochester and in the county around it. And I think like the council person said, reduction is great, but we want to get to zero, right? We want to have no shootings taking place. And so we're embarking in a process. We've already met with the OVP, the mayor's office, SNUG, and others to really think about how can we help amplify and support the work that's already going on in Rochester and the surrounding areas. And we've been very honored to have some very good conversations and to see a lot of the great work that's taking place. And so over the next couple months, we've been working together to really think about what are some of the roles that the health department can play in preventing violence. And from our perspective, we really see violence as a health issue, as a public health issue, right? And I think not as like a metaphor, right, but as actually something that's been declared by the Surgeon General and by the CDC and by the World Health Organization. And so it's really about how do we help, like I said, amplify and support kind of through the health infrastructure, the efforts to prevent violence. So you can go to the next slide, Q. And what we understand from a health perspective, and I apologize if this is very basic and everyone understands it, but we like to kind of say it, is that, you know, violence behaves like a contagious disease, like a contagious process, like an epidemic. And if we treat it like one, we can get results not only on the individual level, but community levels. Communities can be safer, there can be less violence, there can be less exposure. So if you go to the next slide, Q. Hit it, yeah, one more time, and one more time. So like I said,
Did we lose it? We can't hear you. Mr. Decker, did you mute yourself?
I think he may have fallen off the call. So while he.
Did he fall off?
Yeah, he fell off. So
I'll pick up in his place and we'll let him come back. Is that okay?
That's fine, sir.
Okay, thank you all, and please excuse our technical difficulties. So as Brent was saying, you know, we really understand violence as a disease, as a contagion, and you know, there were things that helped us get to that point. So we compared it to you know, to actual diseases, and we noticed that it does have a clustering effect. It does happen in waves, and then we're going to look at the ease, the transmission of it, right? And really the ease, you know, how easily it transmits from one subject to another. Brent, we got you back yet?
Yeah, I apologize.
Go ahead,
can you hear me okay?
Yes, sir.
Yeah, great. So I apologize for that. I'm on my phone. My computer is currently broken. In terms of when we think about the characteristics of epidemic and violence, we see that it clusters. It has a clustering effect. So you can see these are cases of cholera in Bangladesh, and then cases of violence in Chicago. You can see so it has a clustering effect. It spreads like a disease. It follows a similar epidemic wave pattern, meaning that nothing could be happening for a while, but a couple of events take place, and we see these great upticks. And for us, maybe the most important thing is there's a means or a method of transmission, right? So you can go to the next slide. Q, and where this happens is obviously in the human brain, and through observing, through witnessing, through experiencing trauma that can kind of affect the way that we engage with the world. And so if you go to the next slide, and unfortunately, in the issue of violence, there's many methods of exposure, right? So there's community violence, there's violence in the media, there's violence at home, there's violence in the school, there's state-sanctioned violence, and all those things, once an individual is exposed to it, not always, but sometimes they become more likely to perpetuate more violence. And so if we go to the next slide, what we see in many areas where there's a lot of violence, right, multiple exposures lead to multiple outcomes, lead to multiple exposures, and we kind of get where we are. You can go to the next slide, Q. And you go to the next slide, and I apologize, I'm going fast, I know we don't have a lot of time. I mean, obviously in public health, for us, the idea of social determinants of health in terms of the economic, the historical, the racial kind of history of this country obviously plays a huge role in determining anyone's health outcomes, including violence. And so it's always important that the health department is involved in some of the broader issues related to kind of some of the more structural things, like that has to be addressed as part of a health response, right? So we just wanted to name that real quick. If you go to the next slide. The good news is that we know how to stop epidemics, right? And it's not easy, it's hard, but it's really three things: interrupting the transmission, prevent future spread, and change group norms. And so a lot of what folks are doing in this room right now, and some of the partners on the call, are doing these things, right? And so the first part is really about interrupting the transmission, like trying to prevent some of the back and forth. And in our model and other things like SNUG and other work that you all are doing is really having credible folks from the neighborhood who have access, and the credibility with those are most likely to be involved in violence, to step in when something's about to happen, or if something does happen, kind of prevent retaliation, right? So this whole issue of like really having credible workers working in the communities that they're from, with groups that they have either histories with or relationships with or affinity with, right? So that's the first part. That's how we kind of try to interrupt the back and forth. If you go to the next slide, Q. In terms of preventing future spread, again, what a lot of folks are doing in the room is this whole kind of long-term work with folks of really providing resources, of providing new information, providing new skills, really being there for folks over time to really help, especially young people, but think through some of their decisions and make healthier decisions around violence, and then helping with whatever kind of resource needs that are required. And then the last component, again, which is, the next slide, Q, which a lot of folks in the room are doing, are, some of these really trying to shift the normalcy of it being acceptable to use violence in the neighborhoods where it takes place. Because over time, as we get more and more exposed to violence, it becomes like normalized. And so really trying to shift some of the normalcy around shootings, so people make healthier decisions around that. You go to the next slide. And so all of this, like I said, it is really, when we think about it from a health perspective, is not about coming to replace or push out. It's really how can the health department and the health approach work with what's already happening and provide some more resources and some more thinking and some more support on getting to zero, right? To getting so there's no more shootings and killings in Rochester or Monroe County. You can go to the next slide. Cure Violence Global kind of works all over the place in different partners, with different health departments, different mayor's offices, different community-based organizations to kind of support implementing the health approach or health approaches as part of a broader strategy. And the next couple of slides really just about some of the independent evaluations that have been done on the work. All this is on our website, and I don't want to spend too much time on it, but just suffice to say that when we use a health approach as part of our broader strategy, it has been proven time and time again that we can make significant reductions in shootings and killings over time. There have been neighborhoods in Baltimore, New York, South Africa, by doing these things, have been able to get it to zero, that years go by without anyone being shot or killed. And so you can kind of go through some of these slides. I don't want to bore the whole, I know there's a big agenda, but if you go to our website, cvg.org, you can find kind of some of the evidence for this type of approach in many cities in the US, as well as a number outside of the US. And so that's just our kind of very brief overview of who we are and kind of how we see it. Like I said, we'll be working with the health department over the course of the coming weeks and months to have further meetings with folks that are on this call, as well as from the OVC and SNUG and others, to think about where can the health department and the model best support what's already going on. So we just wanted to give a very brief introduction of ourselves and let you know who we were and kind of what we were doing. So thank you. I don't know, Dr. Mahdi, if there's anything you'd like to add, or Kobe or Q.
Yes, I just want to add a few things. This work is very important all over the world, but it's all about relationships and having these critical relationships in these community. You could see reduction, shooting and killing go down when you have these great relationships in the neighborhood. And the areas we'll be working in is where people are from, where they got credibility, and credibility is everything. So it's important to meet these young people where they are. So when we look at the cure violence approach, this model definitely works. I ain't here trying to sell no model, but I'm saying when you hire the right people to do this work, you will see reduction. Just want to add that. And I did a lot of work down in upstate with SNUG early on, over 10 years ago, a lot of upstate sites. And I know this model work, and it really showed people the way how to reduce shooting and killing.
So I would, thank you. First question I would ask for Dr. Merlina is, have we declared, as we know it's been done federally, have we declared, gun violence as a public health crisis here in Monroe County?
So the CDC has done that.
Yep.
We have not done that specifically here.
Yes.
First, I'm sorry. The county executive declared racism as a public health crisis
Yes.
not too long ago. I don't know exactly when. And we know that these violent acts disproportionately impact Black and brown men.
Sure.
We have not taken that next step. There has been some hesitation to do that without reaching out to community partners and really come up with a plan for how are we going to contribute to the solution.
So I would offer for consideration, that being a next step for us in our partnership, that because we do have a solution action plan that was heavily done with the community, that, you know, we have, so we do have some solutions. We do have it was a very robust, community-driven solution action plan meetings that we had to create this plan we did in 2023. So, and it's a working document. And I think I was on the race commission as well too. So I know that declaring racism as a public health crisis, I'm sure maybe in a byproduct as of the race commission report, it just seemed like that would be a connection there. And so I would hope that we can make a similar connection to the City Rock Against Gun Violence Coalition and the Mayor's Office of Violence Prevention collaboratively working together along with the county to say, hey, how can we build energy around utilizing both of those offices and the work that we've done through those offices to collectively come together and be able to take that next step to do that. I would hope that we can have that conversation going forward. What does that conversation look like? Who needs to be in that room? And I would want to do that ASAP, like as soon as possible. What would you say, Mr. President?
I think you were reading my notes. No, in all seriousness,
The powers that be.
in all seriousness, I think it is important that we send a message to the public that this is an all hands on deck approach. It can't just be, us looking for answers through law enforcement, through the traditional means of fighting gun violence, that we really need to broaden the scope of how we address gun violence in our community. I think, one of the other things that I would suggest is, maybe this is something that council can take the lead on starting.
Sure.
You can start it here and then push it up. Say, county, we need you to do it too. But I think we really feel strongly that this message needs to be out there in the community. The other thing I would say is when I look at the Cure Violence model, and I actually have a question related to the model. I've seen the documentary, The Interrupters. I own that documentary. And I know that years ago when Pathways to Peace here in the city of Rochester started, it was training that came from, I believe, Chicago, and I believe the Cure Violence model. And
Well, Mr. President, not to interrupt you, but
yes, sir.
before, because I kind of see a little bit direction. Before you go into that direction or finish, when you finish, after you finish your point, I would like to ask, because I believe that, and let me back up, because I wanted folks to understand that Dr. Merlina office reached out to me to talk about this. And the first thing I said to her is, this sounds very familiar, right? It sounds very familiar. And I know that we have probably partners on the line that I've heard some of you, and I was hoping Vic was on the line, Mr. Saunders, who have mentioned Cure Violence model. I know some of you utilize that or work in that space, and I want to hear from them, but I'm gonna let Mr. President finish his statement. But I want you guys to understand, we weren't trying to create anything new or interject anything that we were already not doing. The county office reached out to me to have this conversation. I said, let's have the conversation. Let's bring in the information. But I do believe that there are other folks that kind of utilize this model or have been introduced to that or work in that space. And so, but I felt instead of us doing that behind closed doors, or that we have this conversation openly and publicly and to discuss how can we grow in what work that we're already doing and work together. So that's what I wanted to be able to do. And I was excited about the county wanting to be a part of that conversation. So I'm sorry, Mr. President, I just wanted to be clear about how this came about, how the county got here. And again, I'm not trying to create no new pure violence program. You know, that's not what this is about. I was reached out to, I was asked to, if they could present, I gave them an opportunity to present, but I know that there are people who are utilizing that model, as you said, and that we have partners who work in that space. But how can we strengthen the work that we can do collectively? That's what this is all about. But I'm sorry.
Yes, thank you. Thank you for that context. So kind of two thoughts just going off of that. One is to the folks from Cure Violence, and then one for Dr. Mahdi as well. So Rochester, I believe, started with this model, and then the Rochester way is always to start with a model and then make it Rochester's own and change things. So I think over the years, Pathways to Peace, for example, and I wish Vic was on the call too, has had probably 3 or 4 different iterations of what it looks like. And I just wonder if part of this conversation and collaboration between the city and the county will also look at how do we make sure that we're presenting the best possible joint model that we can possibly have in the city of Rochester and in Monroe County. So that's the first question. And Dr. Mahdi, for you, just getting a sense of what the collaboration is down the road, because I understand that there was some funding allocated to this potentially. Is there some arrangement between the city and the county? What is the process going to look like down the road once this gets off the ground?
Yeah, so we are here learning and listening and finding out what the community really needs. So I can't really answer your second question because I already know I personally don't have the answers. We brought in our Cure colleagues because they are experts in the field of violence prevention. And so we wanted to bring them in and see how we can bolster and synergize and expand the reach and the impact of work that's already happening. So Brent, if you want to jump in at any point, we're in the phase of learning what's happening and see where we can support. Is there an expansion in terms of geographic coverage? Is there a way we can contribute to equipping teams that are already doing diverse types of work? So I can't answer your second question because we didn't come in already with a predetermined idea of exactly how this system will look.
So before we answer that, let me put this out there. Any of our partners who are on the call right now, are there any of our partners on the call right now who are currently using any of the Cure Violence model? Or is there anybody on the call right now who does that currently?
585 Snug does.
Okay, and we heard them reaching Snug. Anyone else? Okay, so we have at least one organization, Mr. Q and Mr. Decker and Dr. Who currently are working in that space under Snug, and I'm sure you know who they are. Okay, I'm sorry, go ahead, continue, please.
So yeah,
Yeah.
you already reached out to speak. Go ahead.
Yeah, I mean, I think to your question, I mean, I think, yeah, we provided, this is back a million years ago before my beard was gray, some initial training to all of the Snug sites in New York, and we continue to work with New York City to this day. And so, you know, we're very fond of the work that's been done there. I think what we're thinking in this approach, to your point, is not to come necessarily start something new, right? But what are the areas of coverage that might be needed? Are there additional areas that might need some additional staff in the existing programming? Is there, to the other question, is there a series of trainings that might be helpful? Because I think we had, like you said, that the different iterations of folks using the Cure Violence approach, of course, gets adapted locally. I know it's gone through some changes, but is there some sort of uniform training we can provide to everyone in the space? You know what I mean? So the folks have kind of some good support and some of the best thinking, you know, not best thinking, but some of the best practices that have been kind of scientifically validated and things of that nature. And so I think we're very much open to thinking about how this can be additive, rather than coming to, like you're saying, to come start it like a new program on its own. So I think we're very much open to figuring out how does this best fit in.
Good, I see, thank you. I see Mr. Saunders, are you with us now, sir?
Yeah, sorry about that. I had a regional call that ran over.
No, it's
I see you have Brent and the rest of the people from Cure Violence.
Hey, Victor, how you doing?
Hey, Brent, how's it going?
Good to see you again.
Right. So they just finished doing a presentation with us, Mr. Saunders, on the work that they've done and what they're doing. The county is interested in working in that space and collaborating with others and strengthening programs and things of that nature as they build on what the community needs are. And so we, of course, express with them that we know that there's a lot of that work that in that space that you're working on and that you're doing with other, whether it's SNUG or whether it's Pathways, et cetera. And so I don't know if you want to speak to any of that, but basically it's all about just getting everybody working together collaboratively and on the same page as how we can make a larger impact to decrease this violence within our community. Specifically, and as the president just said to me, and I'm very interested because we notice I've been asking a lot about zip codes, and I'm more inclined to say, is there a ways of us looking at this Cure Violence model in particular to what I consider containment or the areas of the zip codes that are most impacted, right? And when we look at the second to fourth, of course, zip codes in the state of New York, whether that's 08, 11, 21, and 05, I would like to see us really being intentional about expanding these models specifically in those geographical areas. So that's kind of the conversation we was having, Mr. Saunders, and we missed your report, so I'm gonna turn it over to you to speak to some of that and also to speak to any other thing that you want to speak to as you normally do each month. Thank you.
Okay, great. I'm happy to hear, Willie, you and I are on the same page, because when I met with them last week, I spoke exactly around the same targeted zip codes. Us having 3 of the poorest in the state, and how we want to be very impactful and intentional in the work that we do as it relates to those zip codes. As far as the Cure Violence model goes, I'm happy to say that I've had a couple of different instances of going to Chicago and doing some training with those guys, and it's very similar to the work that we're doing. The fact that we would be able to integrate their plan is the work that we're doing is ideal. We are basically doing the similar best practices model that they're utilizing in how to target violence in specific areas and be able to offer resources in those areas. So I'm very excited to have had that conversation with them in the county last week and the week before with the mayor and the county executive. So we're definitely moving that information forward, and hopefully we'll be able to collaborate and do some great things here in Rochester. As far as the work that we're doing through the advisory in the mayor's office, we are currently working since the tragedy at Maplewood, looking at our long-term and short-term goals that we want to achieve around the violence that we've seen. We're looking at putting together a collaborative effort of city, county, stakeholders, and community activists and collaborators to put together a seamless approach on how we deal with mass crisis around violence in the community. And we've had a couple of different meetings, interdepartmental, making sure that everything that we're doing within the city is cohesive. And then we're also meeting with the county and their partners. And then we're also going to be meeting with the community and finding out what the community feels the needs for us to address, making sure that situations that might have occurred after this mass shooting don't occur again. So we're looking at all those different things. We're going to be talking to not only family members, but also the people in the community that deploy when situations like this occur. And also look at what shouldn't occur when a situation like this occurs. When we have numerous individuals showing up to sites that really don't have a focus other than wanting to see the situation and be involved. So looking at all those different things right now, we are preparing for the upcoming school year. We understand that there's going to be a lot of different changes within the district. Certain middle schools are going to be starting up that previously were not in place. We want to make sure that we have the supports in place to make sure that all those students are safe. We're looking at doing a lot more around the social emotional work with young people, those that have had issues around the violence and the trauma associated with it, those that might have lost loved ones during these last few months, and those friends and predicates that might not have been directly affected, but as a whole, really have some deep-seated feelings around the violence and the fear within the community. So that's a big component of what we're doing right now. Myself, Dr. Green, Department of Recreation and Human Services, over Office of Violence Prevention. So that's basically it right now. We just had another contingent of our youth intervention specialists come back from Chicago for gang training. And we're looking to get our entire staff, not only school-based, but the entire staff trained in cognitive behavioral therapy. So we'll be able to offer it not only in the 9 schools that we'll be at, but also continue it at the rec centers and other community groups that serve young people.
Thank you. I see, Marcus, you got a hand up. Did you have a question in regards to what we're talking about right now, sir?
Apologies about that. I'm trying to find the mute button. Yes, I do. Now, is there any part of that model or anything, or matter of fact, aside from that, just in general, that is on the plate for actual victims' rights or anything of the people that have been affected from the gun violence, and as far as restitution or trying to make them whole or making sure that repeat offenders are being held?
Well, that would, as far as repeat offenders being held and whatnot, I think that's more in the line of our political aspirations and individuals involved in law enforcement. And our purview as far as intervention and prevention is more specific to making sure that we're looking out for the rights of the individuals who have been having life-altering injuries. The matter of fact, the call that we had earlier was a survivor's call to speak in DC. We're having a delegation going down to DC for the Survivors Walk in September, and a follow-up to work that we've been able to do in Albany and what we plan on doing through the Rochester Youth Violence Partnership, which is our hospital-based intervention program, which now includes life-altering injuries and reduction in gun violence injuries. So we're definitely going to be targeting that. We're working more closely with the hospitals to make sure we have a comprehensive plan to be able to best address victims and the restitution involved in being wounded, and also address the issue that we have a lot of young people that have life-altering injuries from gunshot wounds that need strong aftercare. And not saying that they haven't had good aftercare, but we want to improve on that. We want to improve on the fact that a lot of these young people, when they are wounded and some paralyzed, their families are not prepared for them to come home necessarily because they aren't in capable housing. So we have to make sure that we are allowing for them to have an opportunity to continue their life to the best way possible, making sure they have a quality of life necessary to be able to be successful. So the way we plan on doing that is going after funding that would elicit us to be able to be successful with helping them continue forward, getting the possible rehabilitative care they need, the education that a lot of them are missing, and really move towards a situation where we don't have young people and children that aren't getting everything they need to be productive moving forward.
Okay, thank you.
Thank you. That answered my question good. I'm glad that you mentioned the aftercare. That is a very big thing for me. Thank you so much.
Great.
Thank you, Marcus. Thank you, Victor. Another question from Kathy, and then we got to move on. I'm sorry. Kathy, I see your hand up.
Yes, quick question to the Department of Health. Was there any discussion to declare Monroe County as a public health crisis emergency concerning gun violence? And if not, or if there was discussion, what was the reason for not choosing to do so. I'm sort of perplexed by this only because Rochester has had guns as the leading cause of death for youth for decades. Rochester has the highest in-state supply of short time to crime guns. That's an indicator of gun trafficking. Rochester has the highest gun homicide rate per capita over all the cities in New York State. So I'm trying to understand what's holding us back from declaring this an emergency, a public health emergency.
There has been some debate for quite some time about what would be the utility in doing so when the county itself did not have any resources dedicated to contribute towards the solution. And so there's been conversations about how to adjust budgets, how to make sure that we're not going to declare something as an emergency and then have no way to participate in helping find the solutions, help contribute to solutions that folks were already working on. So with some ARPA funding, quite frankly, that has opened some doors for many folks to feel more comfortable making such a public statement and feeling like they had resources to apply to the problem.
Yeah, the only other thought I had though is, doesn't it allow you then to access funding and resources when you do declare it an emergency?
Emergency from Commissioner of Public Health, a declaration of emergency, even from a county executive, doesn't open up any added funding the way most people think, like, oh, the president declares emergency, a state of emergency, and suddenly FEMA can give victims of a hurricane lots of extra funding. So there's no money attached to that declaration, or we would have been done it. That would have brought in the resources that we needed.
Thank you. Thank you.
What is attached to it though? Outside of just it being a public declaration, there's no other legislation. Like for instance, we know the mayor monthly is declaring a public emergency as a regard, state of emergency, if you will, as a regard of the gun violence that's happening. And it does allow, there is some leeway, or it does expand his ability to legislate in certain areas, code enforcement, some other things that he is able to do. We're looking through the coalition on how we can strengthen that. We think that should be, we can make maybe some charter changes to even strengthen that even more. We know curfews and certain things of that are off the table, if you will, at least for now, but there's nothing.
For the mayor, I am not aware
I understand.
of any new executive power that would give.
The county executive per se.
Yes.
Yeah, right.
So that has been, folks approach many things in emergency, and if we do that for diabetes and hypertension and violence and poverty and food insecurity, at some point, what is the usefulness anymore, the utility? So that's why some folks have been very hesitant and really want to make that declaration when we have an ability to contribute to the solution.
So I'm not going to take another here, Kathy. We're going to move on. It's a little bit past our time here, and I need to move on. So if you have another question, please put it in the chat, and we'll get it to the doctor or whomever that question is warranted to, and we'll get you an answer. But we're going to move. We have reports that we have to do. We do have some of our chairs that are with us this evening, and we want to get to these reports. Thank you, Mr. Saunders, for your input. Thank you for the Cure Violence folks for the presentation. Thank you, Doctor, for bringing that. We look forward to growing the conversation on how we can strengthen these programs and bring more supports. I'm going to go directly to Youth Committee just to kind of give us an update. You guys know we were working on our youth conference. We delayed it a little bit, but it's delayed but not denied. Okay, so we still have the funding, we still have the support, we still got the folks working on it. We just have to, and I'll let Ruth speak to it, and we'll move from there. Sister Ruth, if you want to update us on the youth conference. Yes. Can everyone hear Ruth? Yeah, those are probably not on, Ruth. You're speaking into this mic over here. If you want to come, maybe pull your chair up a little bit, or I'll bring it to you. Go ahead.
Councilman Lightfoot, it's really low.
Yeah, we know. We're working on it now.
Okay.
Working on it now. Go ahead, Ruth.
Good evening, everyone. Can you hear me now?
They said yes.
Okay. One of the things we had our youth conference that was supposed to come off in July on the 6th, and we had to postpone it for a moment. And now we're back in the process of putting everything together. Between now and the end of the month, I will be meeting with my subcommittee, and we will have a date, and we can start moving forward.
Awesome. So just so everyone knows, we have several we just had to get some new dates, and they have all that information. Everybody's on board, everything is approved, ready to go. Matter of fact, they have the program, they have everything pretty much done. And so we're just gonna solidify everything. We'll get a new date. Hopefully by next month, we'll have that new date for you guys. And then we'll just be promoting the event and ready to get it going.
Correct. We need to send out, one thing we need to send out as soon as possible, as soon as we narrow the date down, we need to send out a save the date.
Yes.
So that we can have someone to give, everyone to give us feedback of who is attending. And if anyone has any suggestions, or if they want to take part in it, please feel free to send me an email. Dazzy has my email address, and you can get it from her. And send me an email so that we can get this off, and it would be nice for what we're doing and to inform the community of what we're doing.
We are looking to have an incredible youth conference.
Yes.
It's going to be incredible. We're very excited about it. And so is all of council, and we're looking forward to making it happen. So it's happening, y'all. It's just we just had to regroup, and we'll get more as we get the more information. We'll get back to you, and once we get that date, everything will be rocking and rolling from that point. All right. Thank you, Ruth, Septimus, and everybody who's working on that committee to make that possible. I'm going to move over to hold your questions to the end. I'm going to move over to advocacy. Our president, Lindez, is working on that, and I'll let him give an update on that.
Yes, thank you. From last month, we did have a resolution on the TR amendment that we sent to the federal government, basically requesting that the TR amendment be repealed. And for those that don't know, this is what restricts our gun trace data report from being public, fully public. The data that is redacted in the report could be unredacted if the TR amendment wasn't in place. The other items that we actually are meeting next week as a team here in the council office to talk about the procurement process and legislation related to it, as well as looking at making the gun trace data report either an annual, biannual. We're still figuring out what the length of time would be, but creating a process by which the gun trace data report will happen on a regular basis within city government. That's it for now.
Thank you. Appreciate that. I'm going to go to, is Tanios on the line?
Yep, Tanus is right here. There's no updates at this time for education.
Thank you, sir. Jacqueline, is Jacqueline on the line for eradication? I don't believe so. All right, we'll come back to that. We'll go to Aaliyah for resource.
We don't have any updates. We are continuing to work on our resource guide, and we'll be having a meeting next week.
Thank you so much. Okay, and I believe media would be Lachey. I don't think VP Lachey is on the line either, or somebody from media. I don't believe is there, so we'll get that next month as well. I'm going to go directly into my chairman's update, and my update is going to be specifically on the 10-month update for the Rock Against Gun Violence Solution Action Plan. Last year, we introduced our Rock Against Gun Violence Solution Action Plan. In that plan, of course, we had 12 solutions that were community solutions. We had many more than 12, but we condensed them to 12 because some of them are overlapping, and we condensed them to make the document as small as we could and condensed as we could. But once again, this is a working document to include even the timelines. But I felt that it was important to publicly, it's been 10 months since we introduced that plan, and I wanted to give you an update on what's going on with our plan. Because oftentimes when we do these types of things, people say, oh, they just did this robust community events. They had all of this, they called us in to give us our solutions, and they didn't do anything with it. They just sat on the table and nothing happened. Well, that's not the case with this plan. All right. Solution number 1 is in progress. Update as July 24th meeting. The resource committee is busy creating a resource guide that will specifically focus on the 4 key zip codes and other areas impacted by violence. We're aligning this work with the areas impacted by violence with the community. The education committee has submitted draft victims' rights form to the Rock Against Gun Violence Coalition to myself, includes various existing New York State resources, and they're continue to develop it. Solution 1 was to develop and organize a resource plan for the community. They're working on that. That is in progress. And that was a 6-month to a year timeline we had on that. And it looks like it'll be completed by this year. Is that correct, Ms. Williams, Aaliyah?
Yes, it is.
Thank you so much. Solution 2, we're still haven't gotten to that. Solution 3, we haven't gotten to that. Solution 4, we haven't really impacted on anything on that. Solution 5 is in progress. Updated as of July 24th. We plan the Rock Against Gun Violence Coalition Youth Crisis Conference. You just heard from Ms. Ruth. We're working on that. That's going to happen this year. That timeline was 1 or 2 years, and that will be done within a year. Solution 6, we haven't embarked on yet. Solution 7, we haven't embarked on yet. Solution 8 is in progress. City Council next week, we're looking to introduce, as you just heard from the president, concerning the procurement policy that we're currently working on, working along with individuals from experts from Brady and consultants who have been helping us to put that together. Kathy's been doing a lot of work helping us in that regard. So that's in progress. Solution 9, we haven't done yet. Solution 10 is done. We've called on local governments to adopt Brady Gun Code of Conduct. We did that almost immediately upon us creating this solution action plan. That letter was sent out on 11/12/23 to every municipality that has a gun dealer within their own town or village limits, asking them to urge their gun dealers to sign on to adhere to the Brady's Gun Dealer Code of Conduct. We'll potentially follow up with the sheriff's office, the county executive, county legislator, or ask ATF to make a pitch with all the gun dealers to sign on to the Gun Dealers Code of Conduct. That was solution 10A. Solution 10B was to advocate for city government to pass a local ordinance to require the report of lost and stolen guns with the goal to eventually expand standard to include New York State. Ordinance is already in the City of Rochester Code. Okay, so that is already there. C, call local government to designate gun violence as a public health crisis. We just had that conversation. So that's something that I think we can do. That's something that we're gonna move on pretty quickly to see if we can do it within the city and then ask others to go forward. D is in progress. Call on city government to mandate an annual firearm traces. We're looking at annual and/or biannual gun trace data report. We're currently working on legislation to do that, but we need to be intentional, and Kathy's already brought this out about what are we doing with the one we currently already have. So that's important for us to follow up with that information, and we'll get with ATF, and we've captured that information and those questions tonight, and we'll get back to ATF with that. We have Sean on the call, but we'll wait for Mr. Curran to get back, Agent Curran to get back, and then we'll make sure he gets those questions. E was advocating for city government to develop a policy requiring better trace data. That would be in the report. Advocating for local government to develop an inspection program. We haven't done anything concerning that yet. Call on local government and law enforcement to address the ShotSpotter data gaps. What we've done with that is we have been including the shot data information and data in our monthly reporting that Captain Mura has been doing with us every month. So now we're including that in the information that we are receiving. All right, and so H is advocating for development of county-led violent reduction lab to pilot community-based violent reduction strategies. I think we were kind of, some of that cure violence stuff is actually addressing some of that. So we're having those conversations. I was to call on the county to incorporate the work of the coalition under the scope of the Public Safety Committee. That is done. This now is incorporated under the work of the coalition. I am chairing the Public Safety Committee. The public safety work of the coalition is kind of been adopted under the Public Safety Committee. We have 3 council members that sit on the Rock Against Gun Violence Coalition, which is really unprecedented. And when you think about the 3 of us and what hats we wear, you have the president of City Council, you have the vice president of City Council who chairs and the president chairs the advocacy committee, and then you have the vice president of City Council, Vice President LaShae Harris, who chairs the media committee. Then you have myself, who chairs the coalition, but then I chair public safety of the City Council. So that's a lot of power, if you will, within city government and City Council that sits on this coalition. And so you're going to start seeing, that's why you're seeing things moving, and you're seeing things being supported, and you're seeing things being funded through the help of City Council and city government. City Council in July 2024 update, we passed a memorial resolution related to repealing the TR. You heard Council President just speak to that. And these things had a 3-year time frame added to them, and we've done them in less than 10 months. Solution 11, we did do some of this. We had a community review sessions, the truth behind crime guns. We went out within the community, and we went to all 3 quadrants. So there was 4 quadrants, but we went through 3. We consolidated them to 3. And we went out and we really shared with the community the truth behind crime guns. And we pulled out the data from what was really important, or information from within the gun trace data report that we believe the community need to understand. And we caught a lot of information. We learned a lot from the community in doing that. And we may continue to keep doing that so that we can keep informing the community on the importance of that gun trace data report. Solution 12, which is the final solution. The Rock Against Gun Violence Coalition, we did this. We relaunched the Think About It campaign. A shot from a gun can't be undone. You see the banner here that is also billboards that you should see throughout the city right now. Those billboards are up. They'll be up for the summer months, which tends to be the time where we see more gun violence. And we have PSAs that are running on the radio stations, both Latino and English, if I'm not mistaken, I believe. And then there's a social media campaign that's also happening too, with the shot from a gun can't be undone, just to get people to literally, as the slogan says, but think about it. You know, the decision that they're making before they make that split-second decision to pull that trigger. As you know, when we started this meeting, we were told that there was a shooting of 3 young men that was happening as we speak. That's going on, and of course, so this is ongoing, and we need to continually keep doing everything we can to put other images and other statements out there that combat the normalization of this gun violence that's happening within our community. I'm a big component of that marketing, and I think as they see all of these negative images on social media and all around, we need to counter that with alternatives to gun violence, images and or slogans or statements. We came up, a lot of us, and I might be dating myself a little bit. I know y'all much younger than me, but you know, we had all of these slogans. You know, it's 12 o'clock at night. Do you know where your children are? Yuck Mouth commercial used to come on and make you want to brush your teeth. You know, there were different things that they had that made us do stuff that was positive, that helped us. We don't see a lot of that marketing happening with companies no more, because they tend to got away from their community marketing dollars, and they're putting all their money just to, you know, buying and selling products. But we don't see that community PSA engagement that we used to see years ago. And I'm a big component of that. So I wanted to go over. I know that was quick. I was trying to get us out of here by 7:30. I know that was very quick, but and we'll make sure that you get this update in the update that we send out. It'll be in the minutes. But I wanted to do this in this platform where it's streamed on YouTube, so the community would know and understand, or can go back to. I'm asking folks, please share the link on your YouTube page, Facebook page. Let people understand that the work that they did was not in vain. that we do care, and we are implementing as much as possible of this solution action plan. There are things in this solution action plan that are beyond city government. And in those areas, we're advocating that federal government. In the solution action plan also, there are 9 areas that we identify. Everyone should be able to find themselves in that plan, whether they're federal government, county government, state government, city, school district, community-based organizations, faith-based and clergy, and parents and community should be able to, because how many people know somebody that's carrying a gun? They know before anyone else does, and they can speak up and say something that could stop that person from getting in trouble with carrying an illegal gun. Or how many parents are going into their kids under their bed, into their closets, I know in my house, I went in my kids' drawers, we checked, we looked in, and you have to be intentional about checking on your kids and knowing what's going on in your home. So we're not negating the home responsibility and accountability too, because it all starts in the home. And we believe that they need to be accountable. Parents, grandparents, aunts, uncles, brothers, cousins, sisters, family members, friends, they need to be just accountable to combat and eradicate this gun violence as local officials, government, and clergy, and not-for-profits, and everyone else, okay, and law enforcement. Because if your cousin is carrying an illegal gun, if your friend is toting around an illegal gun, and you need to tell them that that's not the way to go, that's leading them the wrong way, and you need to tell them to stop. So, everyone should be able to find themselves in this solution action plan and see some accountability or how they can engage in this work. So that's all I have for you all this evening. Let us continue to pray for our first responders and for those that have been impacted by all of this traumatic stuff that we've had happening this year and in years past, because we know that people are suffering all the time, even from things that have happened in the past. And we never want to forget any of those victims and any of those people who have been impacted. And let us continue to share information. I want to end on that. Let's continue to share information with each other so that we can be supportive of one another as we go forward. We will be reaching out to you, giving you more information about the progress we're making as far as the ordinances that we have, as well as the youth conference. And we hope to have a lot of this information and a lot of these things completed by our next meeting in September. Kids are getting ready to go back to school. We know we're having a lot of school events. If you're having events between now and our next meeting, please send them over to DASI so that we can be supportive, so that our coalition, and you're going to hear me say that every single month, because I really want us to be unified in this work. And so I appreciate everything that all of you have done. I know our meeting was a little more later than it typically is. I apologize. I appreciate your patience. And I thank you for all of your participation. I see that there is something that was put in the chat now about a Project Tips meeting that is coming up, event that is coming up soon. Final Project Tips is next Thursday, the 22nd at Jones Square Park. Thank you so much for letting us know about that. Final Project Tips is at Thursday, the 22nd at Jones Square Park. All right. Thank you so much for that. We will make sure that we save that and we got that information. And I would just say, God bless everyone. Good night until we see you again, if not before our next meeting, but definitely at our next meeting. God bless everyone and have a good night. Thank you.
I felt bad. I was like, I'm not getting up, but. Yeah.